The main thing about Retin-A is that it can be irritating for the skin, but I have found that most people can tolerate Retin-A if they follow these steps. Hello, my name is Dr. Melissa Chiang, and I'm a board-certified dermatologist at Integrated Aesthetics, and I am doing a series on acne. So for this video, I would like to talk about something that I spend a lot of my time educating patients about, which is how to apply any kind of retinoid, whether it's Retin-A, tretinoin, adapalene, Tazorac, there's many names, but the main thing about Retin-A is that it can be irritating for the skin, but I have found that most people can tolerate Retin-A if they follow these steps. So the first is, don't go for the strongest retinoid, start with the weakest one, because actually your skin will build tolerance. Number two is, don't start off every night. Your goal is every night applications, but you can actually start off twice a week if you have very sensitive skin, or 3 times a week if your skin is more normal. And then what I usually tell patients is, see if you can do that for 2 weeks. As long as you don't have skin sensitivity, then you can bump up your applications from twice a week to 3 times a week. Or if it's 3 times a week, you're already doing it, then you can do it every night. And the main thing to know about sensitivity is flaking is not sensitivity. When you're applying Retin-A to your skin, you will notice flaking, because what it is doing is it is helping to detach those skin cells. So the skin will flake. That is totally normal. But if you notice that you have increased sensitivity, which typically is characterized by a feeling like if you gently touch your face, this might, instead of feeling like fingers, feels like sandpaper. That's a sign you're getting some sensitivity. Then you actually want to stop your retinoid, wait till your skin goes back to normal, and then you can resume more slowly. Some other tricks and tips that can be very helpful is you can moisturize before you put your retinoid on, and that helps it to be more tolerable, but it's not less effective. Other instructions that you want to know about are retinoids will make you more sensitive to the sun, so it is important to protect yourself, and they can make you more prone to a brush burn if you do anything where you're like waxing or using Biore strips and you're peeling off skin. That skin is a little bit more fragile, so you have to be careful with it when you're using a retinoid. So try those tricks and tips, and the vast majority of patients will be able to tolerate a retinoid. Thank you so much for listening. I hope you found this helpful. It's actually not only helpful for acne, but if you want to use a retinoid for anti-aging, the same tricks apply. If you have any specific comments or questions that were not addressed, please leave them in the chat below. And don't forget to like and subscribe. Look forward to seeing you next time.